Welcome, 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 everybody. We're so happy to have you join us today. This event is so important to us here at Kindbody. Truly, we always say that knowledge is power about your fertility, and that really extends to your health in all aspects, and very important for us as Breast Cancer Awareness Month is this month. Ovarian Cancer Awareness Month has just passed. And we've got an amazing panel to connect and share and empower about information that we should all know about screening and testing. And I'm really happy to be able to put this together with Kindbody. Today we have Katya Lezin, who's here with us. She's a two-time ovarian cancer survivor. I feel like I'm describing like a welterweight or like a fighting champion. Two-time welterweight. We have Katya Lezin joining us today. She's going to share her story. We have Dr. Fahima Sassan, our founding physician. She's right there on our amazing Kindbody tea. I have in chat, we have Jennifer, who's one of our customer experience, patient experience team members who always help us and so wonderful in chat. And then we have Dr. Lynn Westfall, who is our chief medical officer. She's right there. Welcome. And then we also have Daniel Luxick. I did it so well at the practice. Is here from Myriad to talk about genetic screening and explain to us the amazing science and what I call the nerdy beautifulness of what we need to know about genetic testing. And we're also going to have Dr. Nastrin Fiozzi join us as well. She's our newest physician to our team, and she's in San Francisco. And she has a double certification. She's a reproductive endocrinologist and also has medical genetics, which is amazing. We appreciate her so much being added to our team and her perspective on this conversation as well. And then later, one of our close coworkers that we adore so much, Kara Sarone's going to join us because one of her closest friends recently froze her eggs in New York with us because she is currently going through cancer treatment, and we're just really happy that we've been able to be part of the future for her friend Shannon, and we're happy to be able to have a conversation and show in the best way possible how we can support and move forward. I personally, my mother passed away 15 years ago of breast cancer. That anniversary was yesterday, and I had told Rebecca, my coworker, Mom, don't worry, it's no problem. We could do the event on any which way or day. And then I realized yesterday when I was tremendously sad, I was thinking, you know what, I'm so glad she made me do this today. So I feel like I'm honoring her memory today. And I also lost my stepmother to breast cancer a year ago. So I know that they are definitely watching down, very proud of the conversation that we're having today. So thank you everyone for joining us. And Dr. Sassan, are we ready to lead us off and kick off this wonderful conversation?
Absolutely. Thank you, Tracy. I'm so excited to be here with all of you, and on behalf of myself and our entire Kindbody team, our hearts go out to everyone who's been affected by breast cancer. We strongly stand by every woman who's currently battling breast cancer, and then as with everything that we do at Kindbody, we really think that awareness is power, and we hope that this next hour that we spend together provides you with some knowledge and education that will hopefully help empower you to make choices that help promote your own well-being and the well-being of the women that you know in your life. Any opportunity we have to help educate is something we feel really passionately about. The picture here is actually some of the members of our New York team, and we're all so excited to wear and support our Breast Awareness Month this past month. So these are our Kindbody shirts with our pink ribbons that we proudly wear. So we'll go ahead without further ado and get started. All right, so at Kindbody, our mission is to make reproductive health and fertility care more accessible. We have built a national network of women's health practices. We do the entire spectrum of fertility and gynecologic care, which I'll go with you in a moment. But I think the most important thing for us is for all women, regardless of your age and regardless of where you are in your journey, to be aware of your body, to be aware of your health, to take care of yourself, and then hopefully be empowered with options. Our mission is to be available to you, whether you're coming to the gynecologist for the first time and you just need a pap smear, to you are trying to conceive, and whether you're trying to conceive on your own or with a partner, whether you are in a same-sex relationship or you want to have a baby by yourself, by choice. We're here for all of those people, and just this is just an example of that outreach that we feel so passionately about. On the next slide, just to let you know what we do, as I mentioned, we do the entire array of gynecologic care, from well woman exams to contraception, pap smears, management of abnormal pap smears, colposcopy, etc. We also take care of urgent gynecologic issues. So, next time you have an urgent issue, instead of going to an urgent care center or an emergency room, we can definitely help with urgent gynecologic needs. We also provide the entire spectrum of fertility care, from just learning more about your fertility. Maybe you and your partner are thinking about embarking on pregnancy in the next year. We can help you understand where you are in your fertility status. But we also do egg freezing, embryo freezing, intrauterine insemination, in vitro fertilization, as well as the entire array of care for LGBTQ family that we care so much about, including donor eggs, donor sperm, surrogacy. And then no conversation about women's health would be complete without including nutrition and mental health. And so we actually have our own therapists and nutritionists that you can schedule appointments with virtually from the comfort of your own home, to help really take care of all of you, not just your pelvic organs. And the next slide, the most important thing to understand when we think about gynecology, and sometimes people ask me, what do you wish everybody knew before they went to the gynecologist? And I think the best advice I would say is, don't be afraid to ask questions. I've been doing this for 15 years, and I'm often surprised by how quiet women are when they come in for their well woman checkups, when I know that we all have so many questions. I mean, I do this and I still have questions myself. And so to really just remember that when you go in for that checkup, again, whether you're there just to get a birth control refill or you're there to learn about your fertility, to ask questions, to be inquisitive. No question should be considered too small. There are no such thing as stupid questions. And any opportunity to have to learn a little bit more about yourself and to better understand why is it that I'm doing this versus something else, I think is an opportunity for growth. And the more information we have, the more healthy we can be. And that also gives us an opportunity to have more options as we embark on our fertility journeys. All right. So the health and well-being, it's really funny because I think that as women, we sometimes think just because we've had a pap smear, that means we've done everything we need to do. And pap smear is just cervical cancer screening. So I think it's so important for us to understand that just by being women, we unfortunately are more prone to certain things. So for example, breast cancer and ovarian cancer, as Katya, who's going to share her story with us, but also we're at risk for heart disease, right? And then that understanding that these things are not, and I know especially when you're young, or you're young at heart, we always think those are things that certainly couldn't happen to me. These are things that happen to other people. And what I want us to understand is that we really need to take care of ourselves and understand that breast cancer happens to 1 out of 8 women, right? And that it doesn't always have to be that you have a family history. Well, family history is really important, but understanding that none of us are invincible, and that any opportunity we have to learn more about ourselves, to learn more about our bodies, is something we should take advantage of. And then we really believe at Kindbody that this knowledge can be powerful, and to treat you as an entire individual, not just to focus on your pap smear and your birth control, which unfortunately is what often happens when we go to the gynecologist, but really wanting to take care of you as an entire person. All right. So what's a well woman exam? We're going back to basics here, but I think it's important. So part of it is a clinical breast exam, and that's really vitally important. So we should do this every year. What has unfortunately happened is that the pap smear guidelines have changed. So now many women who have never had an abnormal pap smear only need a pap smear every 3 years. And unfortunately, the messaging has now become that, oh, if I don't need a pap smear, I don't need to go to the doctor. And so women are now starting to go to the doctor every 3 years, sometimes every 5 years. And I really want to set the record straight. Even if you don't need a pap smear, you should still go to your gynecologist once a year. And that's so important. And so that clinical breast exam has been shown to detect cancer, or to at least detect abnormalities that would then be followed up with screening like ultrasound and mammograms. And this is a really good opportunity to ask your doctor, how do I do my own breast exams, and really get comfortable with how your breasts feel. As the more comfortable you are with what your normal state is, the quicker you could pick up if something feels abnormal. A physical exam is part of a well woman exam. So checking your thyroid, checking your pelvis, looking at external genitalia, as well as assessing your cervix, uterus, etc. And just really going over, how are you feeling, what are your periods like, what's the duration of your periods, talking about your general health, and just an opportunity to really talk about what is it that you want with your fertility, etc., which I'll talk a little bit more about in the next slide. The third part is a pap smear, but I do want to stress that all a pap smear does is cervical cancer screening and testing for HPV. A pap smear is not this catch-all that unfortunately a lot of us women think it is. So I've had patients who tell me my fertility is great because I've had a pap smear, or, oh, I'm healthy, I don't have any risk of anything because I had a normal pap smear. So just understanding all it is cervical cancer screening. It should start at the age of 21, regardless of whether or not you've been sexually active. So even if you have never had sexual activity, you should still have a pap smear starting at the age of 21. And then if your pap smear is normal and you have never had a history of an abnormal pap or a history of HPV, which is the human papillomavirus, then that would be every 3 years, but you should still go to the gynecologist once a year. And then pap smears should be annually if you've had a history of abnormal pap smears. And on a one-on-one basis, your doctor will tell you what further follow-up you need if you've had abnormal pap smears. Next slide. And then the next part of all of this, when you do see your gynecologist, and I hope when you come to see us, is understanding that we really want to be as proactive as possible. So unfortunately, we spend most of our lives trying to not get pregnant, right? Sex education in middle school or high school, when people have it, is focused on preventing transmission of STDs and how to not get pregnant. So a lot of condom education, etc. And then even if you're a physician, I argue even physicians, unless they're OBGYNs, know very little about their reproductive health. And so one of the other things I feel really passionate about is educating women about their biological clock, about their ovarian reserve, and just truly understanding, how does ovulation occur? What is ovulation? What is your menstrual cycle really telling you? And then utilizing that information about your ovarian reserve to make choices that are right for you. Is egg freezing a good option? Is IVF a good option? Intrauterine insemination? How long should I wait? How many kids do I want to have? So all of those things are conversations that we can have and start with you during as early as your well woman checkup, and then continue the conversation in a fertility assessment. Next slide. All right. And so what is a fertility assessment? A fertility assessment can be an adjunct to your well woman checkup. And I encourage women to do this. You can do it once a year and keep an eye on it, or at least do it once to learn more. But it's an opportunity to start a conversation, to talk about your fertility, about your menstrual cycles, and really understand what are your goals, family planning goals. We can start that conversation either virtually or in our clinic, depending on what you're comfortable with. And then we do a vaginal ultrasound to look at your uterus, look at your ovaries, and do a follicle count. And then finally, we do a blood test called anti-Müllerian hormone, or AMH, which gives us an estimation of your ovarian reserve. So it's the ultrasound and the blood test together that can tell us about your fertility. And then before I hand it off, I just want to really stress to you guys, as it is Breast Cancer Awareness Month, how important it is for us to really be vigilant about changes in our bodies. I have a very close family friend of mine who's 24 years old, who just this month was diagnosed with breast cancer. And she subsequently said, you know, I had been feeling this lump in my breast and I kept ignoring it. And it's nothing, it'll go away next month. And unfortunately, at the age of 24, she now has stage 4 metastatic breast cancer. Uh, it, I can't even believe those words just came out of my mouth as a 24-year-old. And so just please, for young people that are out there, for any women of any age, just be vigilant about your health. Listen to your body when something doesn't seem quite right or doesn't feel quite right. Come see us. Let us help you. Go to your doctor, and the quicker you can find out what it is, and hopefully you find out it's nothing, the better it can be. So that's the end of my portion. I wish I could talk to you guys all day, but I'm going to hand it off to our Chief Medical Officer, Dr. Lynn Westfall. Dr. Westfall is our Chief Medical Officer, as I said. She's a reproductive endocrinologist and infertility specialist, coming to us from our San Francisco office. And she's going to talk about a little bit more about family history and risk factors for breast cancer. So without further ado, Dr. Westfall.
Thank you.
And we can go to the next, yep.
Okay. I'm going to give just a general overview of some of the risk factors for breast cancer and guidelines for screening. And I'm going to focus on just average risk women. So women who do carry mutations and things like that, we will discuss a little bit later. Next slide. Breast cancer is incredibly common. I think most of us know someone who's been affected, and 1 in 8 women will develop breast cancer over the course of a lifetime. And most women who develop breast cancer do not carry one of these mutations. So there are a couple of things to keep in mind. There are factors that you cannot change. So the risk of breast cancer increases as you get older, and obviously that's something you can't change. Your reproductive history, the type of breast density you have, and family history and genetic mutations are things that are set. But there are some risk factors and things that you can modify to lower your risk of breast cancer. So exercise is key. Normal weight, your reproductive history, and alcohol consumption are all things that are in your control. Next slide. So these are the things that you can't change. As I mentioned, you know, as you get older, the risk of breast cancer increases, and it increases for many types of cancers. Your reproductive history, again, if you had a very early onset of your periods, or if you have a very late menopause, those result in a longer exposure of estrogen during your life. And so those women are at somewhat increased risk of breast cancer. The type of breast tissue that women have can't change either. So women with dense breasts are at increased risk of breast cancer, and it also can make the imaging more difficult. If any of you have had mammograms and have dense breasts, you may have gotten a letter or a call from your care provider saying that you have dense breasts, and sometimes they will want to do other types of imaging if they're concerned about what they're seeing on the mammogram. And then family history, obviously you can't change. And if you do have a family member or family members who have had breast cancer, that does increase your risk. And genetic mutations, which we will talk about later, specifically the BRCA1 and BRCA2 mutations, do put women at higher risk, and also shifts the age when women get breast cancer. So women who carry these mutations are more likely to get cancer, breast cancer and ovarian cancer, younger than 50. Next slide. So there are things that you can change to lower your chance of getting breast cancer, and many of these things will also affect just your overall health and risk of other cancers too. So we know that exercise and being physically active is really important. And studies do show that women who exercise have a lower risk of breast cancer. Also, as women get older and if they're overweight after menopause, those women are also at higher risk of breast cancer. Reproductive choices also can affect the risk of breast cancer. So women who have their children at a younger age are at lower risk of breast cancer. Breastfeeding is also something that's seen as protective, and having a term pregnancy puts women at a lower risk. Women who never have children are at higher risk compared to women who have had children at a younger age. And alcohol has been shown to increase the risk, and it appears that the more women drink, just the higher the chance of breast cancer. So there sometimes is some confusion about when women should get mammograms, and that's because the guidelines vary from different societies, and also they have changed over time. The American Cancer Society does say that women starting at age 40 to 44 should do screening if they wish to do so. And a lot of these societies say that we should be making these decisions with the patient, and everyone needs to kind of weigh the risks and benefits of whatever information they're getting. They do recommend that women 45 to 54 get mammograms every year, and then over age 55 can switch to every 2 years, or they can continue yearly screening, again, depending on family history and comfort level of frequent mammograms. So the next slide shows just how there are so many differences in when the recommendations are to start screening. But overall, I think the American Cancer Society also correlates pretty well with the American College of Obstetricians and Gynecologists. And so I think it's reasonable to start thinking about getting mammograms around age 40, and then by 45, doing it every year, and then continue that until 55. And some women will want to continue doing it yearly at that point. Most of the societies recommend doing it to age 75. And if a woman reaches 75 and she is expected to live at least 10 more years, then it's reasonable to continue doing mammograms. As Dr. Sasan said earlier, it's just really good to know what is your normal. So, just be aware of what your normal breast tissue feels like. And if you notice anything unusual, go right away. So even if you're young, I know, it's so unlikely. And the story that Dr. Sasan told about her friend at 24, those are rare situations, but they do happen. And I've taken care of a number of women who have had breast cancer in their 20s. So if you do notice anything unusual, you should try to seek medical attention right away. And then there are some women who are at higher risk of breast cancer who may do other types of screening. So some of these women will need to do MRIs or ultrasounds along with mammograms. But for the average risk woman, mammograms are the standard. Next slide. And we're not going to talk a lot about ovarian cancer screening, and partly because there are no really good screening tests for ovarian cancer. Current tests are not very reliable or accurate, especially for very early disease. One of the problems with ovarian cancer is that the symptoms are so nonspecific. But again, this is another situation where if you notice something that just doesn't seem quite right, go in and see your primary care provider, because ovarian cancer can present just as feeling a little bloated or just not feeling quite right. And so it's important, to have your yearly exams, even if you're not getting your pap smears every year. So the Well Woman exam is important just for your overall health, not just focusing on cervical cancer. Okay, so now we're going to talk about genetic screening.
Thank you, Dr. Westphal. Hi, my name is Daniel Luxick. I'm a genetic counselor with Myriad Genetics, and we're the genetic screening partners with Kindbody. So next slide. As we saw in the preceding slides, there's many risk factors which can determine the risk that a woman has to develop breast cancer. Now, most of these cancers happen sporadically, which means they're mostly just due to chance, and they happen predominantly at an older age. And the general population screening methods that we looked at in the previous slides, like mammograms in the late 40s or 50s, are appropriate for these kind of patients. But the preceding slides also mentioned that a risk factor that a woman might have is a genetic mutation like in the BRCA1 or 2 genes. Now, for these patients, it's not appropriate to wait until the 40s or 50s for mammograms. And in fact, MRIs or mammograms will usually begin for BRCA positive patients as early as their 20s or 30s. And using genetic testing is a way that a doctor can tell which factors a woman has and what screening is appropriate for her. Next slide. So the BRCA1 and 2 are instructions that our bodies use to protect us against cancer. And inheriting a broken or a mutated copy of one of these instructions gives women a significantly increased risk of developing certain types of cancer. And in fact, inheriting a BRCA1 or 2 mutation is the biggest single factor that a woman can have. As we can see on this graph, a woman who is BRCA positive may have a risk of breast cancer over the course of her life, up to 87% of a risk. And ovarian cancer, they could have up to a 63% risk of developing that type of cancer. This also points to the usefulness of knowing a gene mutation status in a patient because, for example, many women with a BRCA mutation may have a family history of breast cancer, but unless the doctor knew that she had a BRCA mutation, there might not be a suspicion for an increased risk of ovarian cancer as well, if that wasn't seen in the family history. Now, these mutations are rare, but of course the risk that they confer is very high. So these mutations run in families, and they can be passed down from a parent to a child. You have just as much of a chance of inheriting them from your mother as you do from your father. It doesn't matter which parent they're coming down from. And right now, the guidelines that we have suggest that people with a family or personal history of certain types of cancer get this genetic testing done. There's a few features of hereditary cancer syndromes that we will talk about in later slides, but the most common one that we see as an indication for getting a genetic test is to have a relative diagnosed with breast cancer under the age of 50. Next slide. So it's important that people know their risks of developing cancer and people know their gene status, not just to alarm them, but because there's something that we can do about that. Here at Myriad, we also believe that awareness is power. And that's because as soon as you can identify a risk, you can take steps to mitigate it. So for example, there are risk-reducing agents that a high-risk or gene-positive woman could take, like tamoxifen or aromatase inhibitors, which can significantly reduce her risk of developing breast cancer. Next slide. And also something as simple as an oral contraceptive pill can reduce the risk of ovarian cancer by up to 50%. Now, in addition to these risk-reducing agents, there's also surgical options and, as I mentioned before, enhanced screening options that can all combine to significantly reduce the risk of cancer and drastically improve survival in these patients, but only if we've identified them as being gene positive. last slide. And so finally, for women who are considering becoming pregnant in the future, who have a gene positive status, they actually have a unique option that they can apply the results of this genetic testing. And if they use in vitro fertilization, there's actually technology we have now where we can biopsy the embryo, do genetic testing on it, and only implant the embryos that are gene negative, that are not affected with a BRCA mutation. And in that way, we can assure that future generations or the children of these patients don't also carry these mutations. In any case, whatever options a woman chooses to use or whichever choices she makes, at the end of the day, in this regard, knowledge is power, and that's why we believe in having this kind of genetic screening available to all women. Thank you.
Danielle, thank you so much for joining us today, because I feel, you know, again, we're so happy to be your partner, to be able to provide this screening, to share with our patients and our population. Can we go to the next slide, please? I really am happy to introduce Dr. Nasrin Fiozzi. She is our, again, as I mentioned at the beginning of the call, she is our newest physician, and she's in our clinic in San Francisco, even though selfishly I want her back in San Diego, but that's a different conversation altogether. She is double board certified, and we're very, very happy to have her here today and join us in on this conversation. Next slide. Go ahead, Dr. Fiozzi. Do we have you? Oh, unmute. There we go.
Hi, everybody. Thank you so much. I'm very, very excited actually about this meeting, because it's a long, long time that I feel really passionate about knowledge and giving information to society about the importance of the breast and ovarian cancer screening. I know that my colleagues and also Danielle talked extensively about the genetics, hereditary and non-hereditary causes of the breast cancer and how to screen. I actually wanted to talk a little about the hereditary part and BRCA gene. I wanted to emphasize that it's not only a BRCA or BRCA gene. There are other genes involved with regards that increase the risk of breast cancer. However, they are not as severe as the BRCA. BRCA or BRCA, the lifetime risk of ovarian breast cancer ranges something between 60 to 40%, which is really, really high. And that's the reason we are targeting now these genes. But later on in our future events that we have, we can touch base on the less severe form of the hereditary causes of the breast and ovarian cancer with 30 to 40% risk of developing a cancer. As you know, BRCA, the incidence is about 1 in 300 or 350 in general population people. They carry the gene for the BRCA. And this number goes much higher in Ashkenazi Jewish population, which goes to about 2.5%. And that brings the nowadays discussion between the people who are geneticists and genetic communities, if we should do screen direct to consumer all the Ashkenazi Jewish ethnic background for the BRCA gene. So this brings the importance of screening for the targeted population, and also it brings up the reason why I'm so passionate about this. Not only for this ethnic background, but for the whole the general population, because now we are able to diagnose, and also we are able to offer alternative solutions for these populations. So the hereditary part and breast cancer was discussed very well. The parts that I really want to try to touch base is the association of the BRCA positive and fertility. There are a good amount of the study that has been shown. People who have a positive BRCA1, they have 10 times higher diminished ovarian reserve after the age of 35 compared to the people that they don't have it. And this brings that's the message I'm trying to pass it on. If you have a BRCA1, think about it. You may need egg freezing. If you have a partner, you may need to make the embryo banking before you decide to build your family. And of course, as you know, the NCCN, they are recommending for the risk-reducing salpingo-oophorectomy before, after the age of 40. So this option, the technology reached to the point that now we can offer the fertility preservation for this population. And I'm trying to give the knowledge and emphasize this to our people. So there is a very, very simple way to know if you may have it or not and how to screen, and that card comes in. If you look at the questions, if you have a personal history of breast, ovarian, pancreatic cancer diagnosed at any age, put you at the high-risk person. For the family history, if you have anybody younger than age of 49 or 50 with a breast cancer, anybody basically at any age with the ovarian cancer would put you at risk for carrying the BRCA. Pancreatic cancer diagnosed at any age considers. Male breast cancer diagnosed at any age. This is another part that I want to emphasize. Most of the people, when the mom, sister has a breast cancer, they will say, oh, no, I have a brother. I don't have any sister, so there is no risk. No, men have breast as well, and they will get the breast cancer as well. Yes, the risk is not as high as the female, but it will increase from 1% to 7%. And these people also, male, also need the screening much younger for how to do the breast exam, how to do the screening. Please pass it on to your family. Please let your male member in your family know they will be at risk as well. The other things is that Ashkenazi Jewish ancestry, as I said, is 2.5%. So this breast BRCA screening card gives the good idea that if you will be at risk, and you could be somebody who can basically step in to do the BRCA testing. Next slide. Okay. So now, what happens if I find out that I'm BRCA positive? There are good options now exist through the assisted reproductive technology. If you are single, if you don't have a partner, please think about the freezing of your egg younger than age of 35. It's important. Knowledge is power. It gives you the power that later in life, even though that you are carrying this gene, you have a power to have the family and your dream come true. If you have a partner, think about making the embryo freezing. And why I'm not saying egg freezing, because then when you are making the embryo, you have an option of selecting the embryo against the BRCA. I want to bring this out and make it very clear. By offering the BRCA screening for pre-implantation genetic diagnosis, we are not making or offering to, the goal is not to make a pure human being a population. This never gonna happen. That's always mutation happen in the society, in the world. The things that I'm talking about now, we are going through path of preventive medicine. Why not stop passing the gene that has such a huge consequences from generation to generation, and maybe hoping that the less severe form of the cancer genes, they will survive in the population, but at least help the people that they carry this gene as well to protect their future generations. And basically all of this, both egg freezing and embryo freezing, come with the IVF, in vitro fertilization, which is a process. During this time, we will give some medication, stimulates the ovary, and then harvest the egg. If that's the egg freezing, we are just going to freeze the egg. If that's the embryo, then we are going to make the embryo, fertilize the egg, make the embryo. And as I said, we have an option of selection for against the BRCA gene, and at the same time also we can offer for any other genetic abnormality in the embryo to be selected and then freeze the embryo. I think that's it about the BRCA, but I can tell you and promise you that in future we are gonna plan the event to talk more in detail about the preconceptional genetic screening, because I feel passionate about that and I feel that people need knowledge about that as well.
Dr. Fielzi, thank you so, so much. I appreciate your perspective, and I'm so happy to have our team here today to have this conversation. Can we go to the next slide? I'm super, super excited to introduce Katya Lezen, who, as we said before, is a 2-time ovarian cancer survivor, and really happy for her to share her story with us today. Katya?
Great, thank you. Next slide, please. So one of my fears from the time I was little was of cancer. My other great fear was of sharks, because the movie Jaws did a number on me, but I digress. So one of the reasons that I feared cancer so much was when I grew up, when someone had cancer, you whispered it, right? You would kind of say, "Did you hear about Susan?" And the reason you whispered it is because essentially you were saying that that person was dying. I grew up equating the big C with a death sentence. So about 9 years ago, just before Mother's Day in 2011, I came face to face with this fear. I got a call from my OBGYN that began with the words, "I don't know how to tell you this." I had gone to see my OBGYN, and as the doctor was saying earlier that you should go every year, I was definitely a bad patient who didn't. I was raised by a Swiss mother who believes that a brisk walk outside solves every physical ailment. And so, I'd be the first to bring my kids into the pediatrician, but my stuff would get backburnered. So I had a pain that had started in my rectum, which everyone who knows me finds highly ironic and appropriate, because they've often described me as a pain in that very same area of the body. But I had this rectal pain and I ignored it. But then it came back. So now we're talking spring of 2011. And this time I could no longer ignore it. I knew something was terribly wrong. And the one positive about being a bad patient is that when you call, they take it seriously. I called my OBGYN because at 45 years old, as a bad patient, that was my only, primary doctor. And knowing that usually he had to hunt me down for various things and that I was wanting to come in, he knew it was serious. And so he squeezed me into his lunch hour and he did an ultrasound, and he saw that one of my ovaries had twisted and descended and was rubbing against nerve endings on my rectum, thus causing my pain. Now, cancer didn't come up. I wasn't worried because he wasn't worried. But luckily for me, we live in a country where when you remove a body part, it gets sent off for analysis. And so my ovary went off to the pathologist, and that's where cancer came up. And so I got that call that served as the demarcation between life as I knew it and everything that followed. That call kind of instantly was the realization of my greatest fear and kind of served as the demarcation between life as I knew it and this dizzying new array of new normals of, needle pricks and surgeries and hair loss, and had me kind of suddenly and inexplicably wondering if every family milestone I enjoyed would be my last. Because as has been mentioned already, we've made great strides with breast cancer, but not so much with ovarian cancer. And when I did the mental Rolodex, I was like, that is not a good cancer. I think that's the one that's known as the silent killer. So my OBGYN told me he had to hand me off to a gynecological oncologist, that he had taken the one ovary out, but he was going to need to now do a full hysterectomy. And I was going to need 5 months of chemo, and he had to hand me off to an expert. So I came back to Charlotte to meet with this gynecological oncologist. And this was now spring of 2011. And the significance of that date with respect to what we're talking about today, hereditary cancer testing and the BRCA mutation, is really the timeline is, next slide please, kind of pre-Angelina Jolie and post-Angelina Jolie. A few years later, when she was on the cover of Time and People and wrote her New York Times op-ed about the fact that her mother and grandmother had died of ovarian cancer, and that she learned that was because she had the BRCA mutation, and therefore she had prophylactic surgeries to reduce her risk. One of the things we were talking about, that this knowledge allows you to take the steps you can to greatly reduce, if not outright eliminate, your risk of cancer. That's really what started the national dialogue about ovarian cancer. Next slide, please. But now that's the one thing I have in common with Angelina Jolie, because when my gynecological oncologist walked in the room, before he'd even said hello to me or shaken my hand, he walked in the room, and as the doctor was just saying, as far as one of these risk factors go, his first question to me, truly before he'd even introduced himself, he just walked in the room and he goes, "Are you Jewish?" And I was like, "Are you not going to treat me?" Like, I had no context for this question, right? And so I'm kind of formulating my answer of like, well, I wasn't raised Jewish, but I know a good bagel and lox when I see one, and I married a Jew, and the kids are a work in progress. He didn't want to know any of that, right? He wanted to know, are you of Eastern European Ashkenazi Jewish lineage? Because as she just said before me, 1 in 40 Ashkenazi Jews carries this genetic mutation. So we have a 10-fold risk of having this mutation. It's not enough to warrant testing in and of itself, but it's definitely a red flag that lowers the criteria for testing. And he was right. My paternal grandparents had come over from Russia. Even though when I told my dad that the mutation came from him, my dad was like, "But I was never bar mitzvahed." I'm like, well, no one's going to make the gene chant the Torah, right? It's just a question of where you're from. So despite my Jewish lineage, I was lit up like a Christmas tree because I had 2 other red flags that warranted testing me, which is why he asked me the "Are you Jewish?" question. He already knew it was highly likely I carried this mutation. I had ovarian cancer. That is one of these rare cancers like male breast cancer, triple negative breast cancer, pancreatic cancer, that warrants testing in and of itself. It's thought now that 1 in 4 ovarian cancers comes from a genetic mutation. So you don't even need to be the affected patient to warrant testing. If you have a 1st or 2nd degree relative that had ovarian cancer at any age, that's grounds for testing in and of itself. I also was 45 years old, which is young for cancer and is another red flag. And so my oncologist, he was a little lacking in the bedside manner, like maybe introduce yourself before you ask someone if they're Jewish, but he was on it with respect to genetic testing. And I'm so grateful for that, because he did not treat this as a want to know, he treated it as a need to know. He didn't hand me a brochure and told me to come in when I'm ready. He just said, "I need your weight, I need your blood pressure, and you need genetic testing." It was just part and parcel of my care. And so I then did have the hysterectomy and started chemo. Next slide, please. And I learned that it was irrefutable that I was going to lose my hair. So I elected to shave my head and donate my ponytail to charity so that I could kind of be in control of when and how my hair would get lost, and that I could make something positive come out of it. And that to me was kind of a way of regaining control over this big blind side of having cancer. And in a kind of bizarre way, so was learning about my genetic mutation. Because even though initially it felt like just the hits just kept on coming and more bad news, I very quickly changed my tune, and I realized that within the realm of bad luck of having cancer, the fact that mine stemmed from a genetic mutation was nothing but good luck. And just like being able to kind of control my hair loss and kind of show cancer who was boss, the same thing with the genetic mutation, because the first positive that it yielded, which was huge in terms of feeling a little less bewildered and overpowered by, this blind side of the big C, was that it answered the inevitable "why me?" It gave me a scientific explanation for how and why my cancer had come about. I'm someone who finds science comforting, and it was helpful to know that my cancer wasn't due to cosmic bad luck or, as my mom thought, my Diet Coke consumption, but that there was actually a scientific explanation for how and why my cancer came about. And that same information, as much as it helped me emotionally, absolutely helped my medical team. Knowing the source of the cancer allowed them to better treat it. And as the theme we've heard throughout today, knowledge is power. Knowledge is helpful whether you are the patient, whether you are the provider, or anywhere on the spectrum. It doesn't force your hand as to what decisions you make, but whatever decision you make will now be a fully informed one using the full arsenal of information that's available to you. So that was definitely a positive. Next slide, please. The next positive was that it let me know my odds of getting other cancers. So as Daniel said, sometimes we have hidden cancers in our family. We're concerned about the cancers that have manifested themselves, and that's our cancer family history. But if those cancers are due to a genetic mutation, we might be at risk for other cancers that we're not even aware of as far as being risks. So I had ovarian cancer, which ended up being the less likely of the two major cancers associated with the BRCA1 mutation. I had an 87% lifetime risk of getting breast cancer. I didn't like those odds. I don't know anyone who would, but once you've lost the cancer lottery, I was like, get them off, get them off. And so I elected to have a prophylactic double mastectomy. I had what's called a DEEP, which is when they use the fat from your stomach to make your new breasts. Because if you're looking for your silver linings in your cancer journey, I was like, there's an option that involves a free tummy tuck. Yes, please. Now that surgery was extremely expensive because it was both the removal of the breasts and the reconstruction all at once. And the greatest probably practical gift that my mutation gave me is that I paid not one penny of that $96,000 surgery. And that is because the mutation not only let me know my risk, but it also let my insurance company know my risk. It quantified that risk and spoke a language that the insurance company could understand. And so rather than my saying, I have this one cancer, and now I'm really scared of getting this other cancer, it put into concrete, scientific, factual terms how likely I was to get that cancer, how based in science and numbers my fear was. And so they were very willing to pay for that very expensive surgery, because as expensive as it was a lot less expensive than paying to treat me for cancer, a cancer that I was very likely to get. And just as a quick aside, I will share with you that I thought probably is obvious to you, humor was one of my coping mechanisms during my cancer journey. And when I had this surgery and learned about all the options for taking your breasts off and putting them back on, we learned that there were also nipple decisions to be made. You know, you can choose to have, you know, nipples surgically attached, you can have 3D tattoos. And in our family, this was dinner table conversation. And my 15-year-old daughter suggested that instead of having a nipple tattooed, I have this tattooed. Next slide, please. I don't know if you can read that. If it says, if you can read this, you're too close. So that was her suggestion for the tattoo on my breast. I'm actually a 2-time ovarian cancer survivor. So I know I've really bucked the odds. And in fact, when my cancer came back, my mutation came into play again, because the frontline attack on a recurrence of ovarian cancer is what's called a PARP inhibitor. And when my cancer came back at the very end of 2013, PARP inhibitors were not FDA approved. So I was going to have to undergo the logistical, financial, and emotional upheaval of being treated in a clinical trial away from home. Luckily, the surgery, it occurred on my spleen and I had a splenectomy, took care of all visible signs of the cancer. But now PARP inhibitors are FDA approved. And they are FDA approved because of the partnering diagnostic tool that is the Myriad MyRisk test. And I'm so grateful that the fine folks at Myriad, who aren't just finding mutations to put on these panels to test for, you know, all the different things that we can predict and prevent, but they're also partnering with the fine folks who are trying to find treatments and protocols and hopefully one day a cure. So now we do have some forward momentum and some advances with ovarian cancer, which, you know, allows me to kind of just put my cancer on the back burner and not live every day consumed with fear and worry. And then my final positive of learning about this mutation, next slide, please, is that this is a gift I am giving my kids. So these are my 3 children, and this was a picture that was taken relatively recently. It was last summer, and it was actually at a very sad occasion. It was at my dad's memorial service. We lost my dad last July at age 90, but I found myself thinking about my mutation even then, because I was so grateful that I was at his memorial service and he was not at mine, right? I mean, by all accounts, I shouldn't still be here. I'm very humbled and happy to be able to say that I've twice beaten ovarian cancer, but I truly credit my mutation and the information it provided me and my medical team and the odds that I was able to kind of overcome with allowing me to still be here and allowing my dad to live 9 decades without having had to bury his daughter. Now, I also have this picture because my 3 kids are the greatest gift of my mutation, because what it did was it allowed me to take one for the team so that my loved ones can be spared all that I went through. I've had over 10 surgeries. I've had a dozen overnight hospitalizations, the removal of multiple body parts, hair loss, needle pricks, you name it. I don't know any parent who wouldn't want to spare her children that. So my children each have a 50% chance of inheriting this mutation from me. My son is 26. As she mentioned earlier, he should definitely be tested. He has a slightly lower risk of male breast cancer and prostate cancer, not nearly to the extent that we see the women's cancers within this particular mutation, but he could also be a carrier. My dad is the one who gave me my mutation. My dad has no ovaries, but he gave me ovarian cancer. He is one of 3 brothers, so there were not a lot of women on that side of the family to manifest the cancers that would have ordinarily given us a heads up. So we had a truly hidden mutation in our family that we didn't learn about until I got ovarian cancer. But my 2 daughters, if they have this mutation, have the same risk that I do of an up to 63% lifetime risk of ovarian cancer and an 87% lifetime risk of breast cancer. So of course, medical management is going to drastically change for them if they have this mutation. My daughter Hannah, who is 24, has been tested and she is positive. So she has inherited this mutation from me. And I will tell you, as a mom, where I used to talk about this theoretically and say, knowledge is power, but without my sweet redheaded blue-eyed daughter having tested positive, you know, when it was all theoretical, it was definitely an easier message. But I stand by my words and my message, because at the end of the day, as much as I wish that Hannah didn't have this mutation, what I really do not want to have in common with her is cancer. And Hannah now can do what she needs to do to greatly reduce, if not outright eliminate, her risk of cancer. And Eliza, my youngest, who has not yet been tested, if she's positive, like her big sister, she'll do what she needs to do. But she could also be negative. And if she's negative, she's what we call a true negative, which means that the cancer in our family is explained by a mutation. If she doesn't have it, she goes from a 63% lifetime risk of ovarian cancer to a less than 1% general population risk. So sometimes the very people who are the most fearful of being tested are the ones who would most benefit from being tested, because sometimes they are needlessly and unnecessarily carrying around this fear. So either way, whether it's positive or negative, knowledge is power. Next slide, please. And as I said, I'm so very grateful that I still get to be here to enjoy all of these family milestones and time with my loved ones. And I just think it's a wonderful thing that you all are being offered, that you too can benefit from this knowledge and go forward to live vibrant, full, and happy lives. Thank you.
Katya, thank you so much. You made me laugh and cry. I definitely like a whole movie journey. I've just gone through in 10 minutes, but I can tell from our conversations, the only thing that would make me happier is if you had a puppy with you, which I'm hoping will be in your future. She and I were speaking earlier, and we're both dog crazy. So we're excited. That's the next journey for Katya is getting a dog. But from the bottom of my heart, I really appreciate you sharing your journey and sharing with about your family. And like I said, being my mom having breast cancer, I was tested and it gave me a lot of anxiety. Like what is that going to be? And thankfully I'm negative. But I agree with you that was the power I needed to know how to navigate my next steps in everything that I did. And you really gave me a perspective just now of thinking that all that my mom went through, I now have been tested. And I think that would be the biggest gift that she would know that she's given me, is that now I've been tested and know that I'm negative. So thank you so much. And that I'm definitely taking that piece to heart.
Oh, that's awesome. Thank you.
Thank you. Next, we have one of my amazing and lovely, lovely coworkers, Kara Sarone's going to join us. She is going to speak on behalf of one of her close girlfriends, Shannon, who unfortunately was just diagnosed with breast cancer. And this is Shannon here. This is her photo. And that's Shannon with her sweet, delicious baby at our clinic in New York. Kara, I'd love for you to just share a little bit about yourself and Shannon and all that she's been going through recently.
Yes, thank you, Tracy, and thank you, Katya, too, for sharing your story. It's so important, and it's one of the main reasons I love working at Kindbody is that we really, truly educate and empower women how to live their best and healthiest lives. And last month, like Tracy said, and you did make me tear up, so I might even tear up during this little pitch, but speaking on behalf of Shannon, but last month, my best friend and my lifelong friend at 30 years old got diagnosed with breast cancer on her daughter's first birthday. So this whole mission and what we do in our clinic and Breast Cancer Awareness Month took on a whole new meaning to me. It's now personal, so watching my best friend over the last month try to navigate this whole entire system and really get in front of all the best providers and provisions in care. And of course, as soon as she had her first meeting with the amazing doctors at MSK who really encouraged her, in addition to me, to preserve her fertility, she called me at literally 4:30 saying that she wants to move forward with Kindbody. And of course I was so thrilled. I was in the middle of my work days trying to, coordinate with the team. But when I got out of the meeting at 6:30, Shannon already came to our Kindbody clinic. She already had her authorization, her eligibility check. She was already saw Dr. Amy and was already proceeding with her treatment. And it was just so touching to be able to know that I didn't even have to do anything with my amazing Kindbody team, that she was fully taken care of from everything from like the patient experience to a treatment plan to having her coverage identified. So really super empowered with all this information, and it's just the true Kindbody way. And like Tracy put on this slide, the fertility preservation, and knowing that her doctor suggested this path forward really gave her hope and really allowed her to focus on her life after cancer, and that knowing that by knowing her options and really prepping her with the best tools out there, that she's gonna make it through. And I think that having this one little box checked off on her list has really empowered her to continue fighting on and have this amazing positive outlook on how she can continue to plan her, not only her life, but her family's life after cancer. So really, it just gives me all the feels, as I told my Kindbody team, knowing how amazing each and every one of them are, from, again, from the billing, because like you said, Katya, the insurance part is probably the most challenging part to navigate. So knowing that everyone is so aligned and putting the patient forward is just really touching. So I'm so grateful for this Kindbody team. And one thing that we are really excited to do as a part of this event is Shannon is wearing this mask chain on the screen, and one of our other best friends is also in the picture. She created this mask chain in honor to support breast cancer awareness. So we are going to be raffling off this mask chain for everyone on this call on this event, and all the proceeds go to Breast Cancer Alliance. So I'm really excited, and thank you, Tracy, so much for including me and Shannon in this.
Thank you so much. You did good, Kara.
I know, I'm trying not to cry, but because it's just really so amazing.
That's all right. It's okay. And again, that's because we're having real amazing emotions in connectivity. And, we normally love our events in person, but I have to say, I feel really blessed that we can, from coast to coast, have a true conversation. And Katya, I'm again so thankful for you speaking with us today, and Daniel, Dr. Fiozzi, Dr. Westphal, and Dr. Sasan. I'm just really, really blessed that we were able to have this conversation, and every single person who took the time to join us, I really thank you as well, because I hope that you tell 5 people, and then like you said, is spread it further and further. It's exactly what Dr. Fiozzi said, is we have to spread the word, that males are not eliminated from this conversation, and that we have to be honest and open to do it. And like I said, I personally was well overdue for my mammogram, but I made a promise to myself that I would schedule before this event today, because my husband actually said, oh, you're going to host a breast cancer and ovarian cancer awareness event. When's your mammogram? And so I was like, okay, so I did do that yesterday. And I'm thankful to Kindbody to be open and honest and have the conversation. Can we go to the next slide, please? So because what we're doing is we really want to offer a discount to everyone, because we really feel our mission at Kindbody is to make fertility care accessible. And so in addition to the BRCA screening and the question, the Q&A that we have, we're also going to give a discount, and that's $1,000 off any of your egg freezing cycle or IVF cycle. And then your fertility assessment is usually covered by insurance, and the same with your well woman exam. You can absolutely be a cash pay patient as well if you do not have insurance, but the code is awareness is power, and that is to give you a discount for treatment. And we would love to be able to help you and support you through your journey, however that looks like. Is that our last slide? It may be. And so here is the questions. This is more information on the BRCA testing information. Basically, if you answer yes to the questions that we had, and you'll see, because I know that we've sent out, we're going to have a follow-up email as well, Rebecca. Is that correct? I don't want to misspeak. For the information about the BRCA testing, because we still, until the very end of the month, we're doing this partnership with Myriad to have the BRCA testing. And then there is, if you answer yes to the questions and you are a risk factor, it'll be hopefully to 75% will be $0, and then at a max of $54, which is an incredible, incredible rate to have this testing done. But we would love to be able to help. Please feel free to share this with any of your friends that you know, because we really want to get as many people tested as possible. And that may be it. And if anybody has any additional questions, please feel free to email our team at navigator at Kindbody. So if you have any questions, if you're not sure if you're eligible, if you want them to send you the questions, any of that information, you can always follow up with us. But I know we went a little longer than our 1 o'clock hour, 3 o'clock hour, or 4 o'clock hour, but thank you to everybody. We really, really appreciated you for coming and joining us today. And I thank my speakers. And Katya, I'm going to be harassing you weekly saying, where's the dog? I want the dog picture. Yes. But thank you all. Have a wonderful rest of your day. And again, reach out to us if you have any questions, and we hope to talk to you soon. Thank you. Bye, everybody.